Abnormal bleeding is bleeding that is heavier than what is normal. Normal is considered bleeding that's 5 to 7 days using approximately 4 pads or tampons in a day.
Symptoms can include bleeding in between your period, bleeding excessively during your period, or if you have bleeding after you've gone through menopause.
Abnormal bleeding is evaluated by ordering lab work, usually performing an ultrasound and performing an endometrial biopsy if indicated. Treatment options for heavy bleeding depend on the age of the person who is having the heavy bleeding. Options can include birth control, an IUD. There are procedure options also, including an endometrial ablation. In extreme cases, a hysterectomy might be necessary. Success rates for an endometrial ablation are very good. In general, there's about a 98% patient satisfaction rate.
The procedure is an outpatient procedure. It actually can be done in the clinic, and it takes less than 5 minutes. And it basically can normalize your bleeding.
An endometrial ablation in general is not painful. The intention of the endometrial ablation is to make periods lighter, not necessarily to make them go away. Approximately 50 to 75% of women do have their periods go away completely, however. An endometrial ablation is not necessary after menopause. Follow-up after an endometrial ablation is very simple. In general, unless a woman is having a problem, she only needs to return for annual visits.
Usually you may have some abdominal cramping or mild pain, but usually patients can go back to work the next day.
If you feel like you have abnormal bleeding, you should call your gynecologist's office to schedule an appointment. This appointment would include a discussion, ordering lab work, perhaps ordering an ultrasound, and to discuss treatment options.